Dental implantation is a surgical procedure used to replace missing teeth with artificial tooth roots made of biocompatible materials, usually titanium or titanium alloys. It is considered one of the most effective and long-lasting solutions for restoring the functionality and aesthetics of a person's smile. The dental implant itself is a small, screw-shaped post that is surgically placed into the jawbone. This post acts as an anchor for the replacement tooth or dental crown that will be placed on top. The implant integrates with the surrounding bone through a process called osseointegration, which allows it to become a stable and permanent part of the jawbone. The process of dental implantation typically involves several stages, although the specific steps may vary depending on individual cases. Here is a general description of the procedure. Initial consultation. The process begins with a thorough examination of the patient's oral health. X-rays, CT scans, and other diagnostic tests may be performed to assess the condition of the jawbone and determine if there is sufficient bone density to support the implant. Treatment planning. Based on the examination results, a treatment plan is developed. This includes determining the number of implants needed, the type of restoration, single tooth, multiple teeth, or full arch, and any additional procedures that may be required, such as bone grafting or sinus augmentation. Implant placement. During this surgical phase, the dental implant is placed into the jawbone. The dentist or oral surgeon makes an incision in the gum tissue to expose the underlying bone, drills a small hole, and carefully inserts the implant. The gum tissue is then stitched back in place. Osseointegration. Over the next several weeks or months, the jawbone undergoes a process called osseointegration, where it fuses with the implant. This creates a strong and stable foundation for the replacement tooth. Abutment placement. Once osseointegration is complete, a second minor surgery may be performed to place an abutment on top of the implant. The abutment serves as a connector between the implant and the final restoration. Restoration placement. Finally, a dental crown, bridge, or denture is fabricated to match the shape, size, and color of the natural teeth. The restoration is then securely attached to the abutment, completing the dental implantation process. Following the completion of the procedure, patients are typically advised to maintain good oral hygiene practices, including regular brushing, flossing, and dental check-ups. Proper care of dental implants can significantly prolong their lifespan, often allowing them to function effectively for many years or even a lifetime. It's important to note that dental implantation is a specialized procedure that requires the expertise of a skilled dentist or oral surgeon. If you're considering dental implantation, it's best to consult with a dental professional who can evaluate your specific case and provide personalized guidance. The dental implant itself consists of three main components. Implant fixture. This is the part that is surgically placed into the jawbone. It is typically a small, screw-shaped post made of biocompatible titanium. The implant fixture acts as an artificial tooth root, providing a stable foundation for the replacement tooth. Abutment. Once the implant fixture has fused with the jawbone through a process called osseointegration, an abutment is attached to it. The abutment is a connector that protrudes above the gum line and serves as a support for the prosthetic tooth or crown. Prosthetic tooth/crown. The final component is the prosthetic tooth or crown, which is custom made to match the shape, size, and color of your natural teeth. The crown is usually made of ceramic or porcelain materials, providing a durable and aesthetically pleasing replacement tooth. The process of dental implantation typically involves the following steps. Initial consultation. During the first visit, your dentist or oral surgeon will evaluate your oral health, take X-rays, and discuss your dental history to determine if you are a suitable candidate for dental implants. They will also address any questions or concerns you may have and develop a treatment plan tailored to your specific needs. Implant placement. The surgical procedure begins with the placement of the implant fixture into the jawbone. This is done under local anesthesia to ensure your comfort. The dentist or oral surgeon makes an incision in the gum tissue to expose the underlying bone, drills a small hole into the jawbone, and carefully inserts the implant fixture. The gum tissue is then stitched back in place, and the implant is left to heal. Osseointegration. Over a period of several weeks to a few months, the implant undergoes a process called osseointegration, during which it fuses with the surrounding jawbone. This provides a strong and stable foundation for the prosthetic tooth. Abutment placement. Once osseointegration is complete, a second minor surgery may be required to place the abutment. This involves reopening the gum tissue to expose the implant, attaching the abutment to it, and then suturing the gum tissue back around the abutment. In some cases, the abutment may be placed during the initial implantation surgery, eliminating the need for a second surgery. Prosthetic tooth/crown placement. After a short healing period, during which the gum tissue around the abutment may be shaped and contoured, your dentist will take impressions of your teeth. These impressions are used to create a custom prosthetic tooth or crown that matches the color, shape, and size of your natural teeth. Once the crown is ready, it is securely attached to the abutment, completing the dental implantation process. After the procedure, it is essential to maintain good oral hygiene practices, including regular brushing, flossing, and dental check UPS. Dental implants have a high success rate and can last for many years or even a lifetime with proper care. Dental implantation is a surgical procedure used to replace missing teeth with artificial tooth roots made of biocompatible material.